Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
All are true about innate immunity except innate immunity acts as first defense of the body. True. Complements are examples. True. Complement proteins, all T cells, B cells, all those are innate immunity. It is non-specific. True. It is not affected by genetic influences. No, it is affected by genetic influences. So this is false statement. Thank you. Transfer factor is an example of adaptive immunity. Adaptive immunity is nothing but also called as acquired immunity. So in this adaptive or acquired immunity, there is this acquired immunity can be obtained by the infusion of T lymphocytes. So what is this adaptive immunity? It is an acquired immunity. Let me 1 minute. This adaptive immunity is actually an acquired immunity which is obtained. How will one get this adaptive immunity? In this adaptive immunity, we will inject the immunocompetent T cells. Immunocompetent T cells are injected. So this is called as transfer factor. Actually, this is used. Is this used anywhere? Yes, this transfer factor is actually used in treatment of conditions when the cell-mediated immunity is low. So, for example, it is used in treatment of lepromatous leprosy. Thank you.
thank you and thank you for watching.